Well, welcome everyone. It's Dr. Mercola, and today we are joined by Dr. Christiane Northrup, who is a practicing physician, an OB-GYN specialist, who has dedicated a good portion of her life to helping women take control of their health. She's also a published New York Times author, and hosts a radio show, and is a prominent speaker on natural health issues, especially related to women. So welcome, and thank you for joining us today, Dr. Northrup.
Thank you. It's my pleasure.
I'm wondering if you would be kind enough to share with our viewers your journey and how you became passionate about encouraging and inspiring women to take control of their health, because I'm sure it's an interesting story.
It is indeed. I grew up in a health-conscious family. My aunt and uncle were both medical doctors. My dad was a dentist. We would call him holistic now. He actually used to take yogurt to his patients who were on antibiotics. This was before Dannon. My mother made the yogurt, and he would carry it down the street. I grew up in a small town south of Buffalo. So I understood about probiotics. We had our orange juice was spiked with vitamin C. We had cereal from Walnut Acres that was organic. And my dad believed that you could tell the state of a person's health through their smile and their mouth. And as a dentist, he was into making sure that that mouth and that smile were very healthy. On the other hand, my aunt and uncle were standard conventional docs. And so the beauty of that is that at Thanksgiving and Christmas, I got the chance to see the difference between my father's philosophy and my aunt and uncle, his brother and sister. And it wasn't until I had two siblings, one who died and the other who was signed out of the hospital against medical advice. I was about 8 or 9, I think. My sister had died. My mother took a lot of antibiotics during her pregnancy for pneumonia. They probably damaged that baby. The second time this happened, my brother Bill was born. He also wouldn't eat. A nurse told my mother, this would never happen now. She told my mother, if I were you, I'd get him out of the hospital. The doctors don't know what's wrong with him. And so my parents signed him out of the hospital against medical advice, fed him by an NG tube, nasogastric tube, every hour on the hour. At the age of a year, he weighed 10 pounds. They finally took him to a pioneer in pediatric endoscopy at what was then Women's Medical Center. And she determined that he had an eroded esophagus from the NG tube, took the tube out, said, let's just see what happens. And he finally recovered on his own. And when I interviewed in medical school, the doctor who interviewed me in Buffalo said, are you related to that Northrup? Because he thought my brother would be retarded. They told my mother he would either die or be retarded. Are you related to them? And I said, he's my brother. And of course, he's fine and has a very high IQ. No thanks to you folks. So I learned early on the limitations of modern medicine. And then when I went to medical school, I had all of this family history of healthy food. My parents did yoga when I was 13. They jogged. We were into health as opposed to disease. And not trying to prolong life. My dad died on the tennis court. He was 68, and he always said to me, someday a blood vessel is going to burst in my head and I'll float out into the universe. And when I heard that, I was a second-year resident at Tufts New England Medical Center, and I thought, my first thought was, Dad, you did just what you said you were going to do. So it's not about living forever. It's about living well while you're here. And so when I saw what was happening in women's health in my OB-GYN residency, I saw a couple things. One, a woman's body was treated as a disease waiting to happen. Pregnancy was a disease. A normal labor and birth were considered a retrospective diagnosis. So everyone was treated like a disaster waiting to happen. Breasts are treated as two pre-malignant lesions sitting on your chest. So the whole discussion of women's health is what can go wrong, what can go wrong, what can go wrong. In my medical training, it was the male body that was the standard, the gold standard. The female body was a lemon, less than. And I realized that this approach was not really helping women. And so I had to invent a language of actual women's health, because we think that women's health is disease screening. We think that women's health is pap smears and mammograms, or whatever you're screening with. And that's just screening. That's not building health. That's not feeding cells the nutrients, the thoughts, the emotions that they need in order to continue to reproduce themselves in a healthy way. You know, I know, the body replaces itself totally every 7 years. And it will replace itself in a healthy way depending upon what you're feeding it on all levels. Women have a problem. Most of us are brought up with the myth, some kind of myth, at least in the Judeo-Christian ethic, about the myth of Eve. All the problems of humanity have been caused by the fact that someone named Eve ate an apple, and therefore she caused the downfall of humanity. And I believe that stays in our cells somewhere until we wake up and say, wait a minute, I don't think so. I don't think so. So that's my history. I first saw a baby born, burst into tears, was glad I was wearing a mask. I'd never seen anything so beautiful or powerful. And that's why I went into OBGYN.
Well, thank you for that explanation. It was really inspiring. And just a few comments on it. I found it interesting that your dad sort of had a self-fulfilling prophecy inspired at 68 while playing tennis. That was pretty interesting. So, but the other thing that I found fascinating was you mentioned that your brother's experience would not be possible today because you had signed out AMA, which is against medical advice. And the practical reality today, because I've just actually personally encountered this with a friend who was in the emergency room, if you threaten to do that, they will abolish all your insurance rights. So you are paying, yes. That's what they do. They say, if you sign out AMA, you can do that. It's free. It's a free country, but you will not be covered by insurance. So your question is to stay there and endure further pain and suffering and inappropriate treatment, or to get a bill of $20,000 to $30,000.
I can't believe that. I used to be the queen of signing out against medical advice. The nurses would call me during my residency. Oh, so-and-so is leaving against medical advice. What I would do is run down and talk to the person, and invariably they were not getting the information they needed. All they needed was someone to actually talk to them, listen to them, and then we could make the care what it needed to be. So I find that incredibly distressing and very fascist.
Yeah, well, it's probably motivated mostly by economic means, because this person I was with was there for chest pains. They had just received a nuclear treadmill 2 days prior, and the chest pain was from some post-surgical thing, but because the word chest pain was mentioned, they wanted to put them in for overnight for observation. So maybe the threat was just, I don't know, it was meaningless, and it wouldn't have been, but that's what that was the threat. So, you know, that's a powerful motivation to keep people there. But yeah, I think you're right. Most of the time it's related to miscommunication, and a little bit of work like you've been doing can help smooth the surfaces from that. But a lot of times, you know, they're not as enlightened physicians as yourself, and they're entrenched in this model which any educated consumer will know is not going to make them healthier. It's going to make them worse and could kill them.
Speaking of signing out against medical advice, when I was interviewing in medical school, I was interviewing at Yale Medical School, and my dad was admitted to the intensive care unit with chest pain. Speaking of that, and he called my mother after 2 days. He was in the CCU, the cardiac intensive care unit, and he said, "Edna, come and get me. They don't know what's going on with me." And so she went in, got him. The nurses were furious. He had an infiltrated IV that had caused phlebitis in his arm. And she took him out of there. They wouldn't give him a wheelchair. He left with the chest lead still hanging onto his chest. And when I got home from my med school interview, he was sitting up in a chair with fluid 2/3 of the way up in his lung fields, and he recovered on his own. They, in fact, did not have the right diagnosis. He had pericarditis. He did not have a heart attack. They were treating him improperly, and he healed on his own. So imagine having those key experiences as a relatively young person going into medicine. You are already immunized about the limitations of the medical model. And I wish for everybody listening, and I know this is, of course, your group of people, where we are immunized against believing everything, hook, line, and sinker. So I teach people to trust their own intuition and dip into the system when they need it. It's great with a car accident, a broken bone, whatever, but it's pretty awful with basic health.
Yes, indeed. So let's get back to your specialty, which is women's health. And you had mentioned in your introduction that the traditional view of women's health is mostly focused on screenings. But as being a leader in women's health, I would really appreciate your comments on that topic, specifically mammography, because it's a very controversial issue. We've gotten some pretty strong positions on it. So I'm wondering if you could comment on that, and maybe even specifically the new mammography, the 3D tomosynthesis mammography, which is supposed to be so much better. So we would appreciate your comments on that.
Well, first of all, I think that the new tomosynthesis is definitely a better mousetrap. It's less compression, so it's less painful, and the number of recalls is less. Having said that, I keep going back to the work of Gilbert Welch from Dartmouth. I believe that this paper by Gilbert Welch is the most important paper to come out about breast cancer almost in my entire career. Gil wrote a book called Should I Be Tested for Cancer? Maybe Not. And that was in 2004. Now he comes out with a paper that has everyone riled up, and it's called The Effect of 3 Decades of Screening Mammography on Breast Cancer Incidence. Let me cut to the chase now. And he says, with the assumption of a constant underlying disease burden, only 8 of the 122 additional early stage cancers diagnosed were expected to progress to advanced disease. After excluding the transient excess incidence associated with hormone replacement therapy and adjusting for trends in the incidence of breast cancer among women younger than 40, we estimated, and this is the important part, we estimated that breast cancer was overdiagnosed. That's tumors were detected on screening that would never have led to clinical symptoms in 1.3 million U.S. women in the past 30 years. We estimated that in 2008, breast cancer was overdiagnosed in more than 70,000 women, and this accounted for 31% of all breast cancers diagnosed. So here's the problem. And over that time period of 30 years, he estimates that 1.3 million women were diagnosed with breast cancer, which is basically ductal carcinoma in situ, which they're calling stage 0, which women would, as Gil says, die with, but never die from. And he pointed to a study way, way back of women who died in car accidents in their 40s, and they sectioned their breast tissue and found that 40% of them, this is normal, healthy women dying in car accidents, 40% had evidence of ductal carcinoma in situ that was never going to go anywhere. And this is the big dilemma. I want to point to another study. This was from the Archives of Internal Medicine, November of 2008. This study followed more than 200,000 Norwegian women between the ages of 50 and 64 over 2 consecutive 6-year periods. Half received regular periodic breast exams or regular mammograms, while the others had no regular breast cancer screenings. The study reported that those women receiving regular screenings had 22% more incidence of breast cancer. The researchers, as well as another team of doctors who did not take part in the study, but who analyzed the data, concluded that the women who didn't have regular breast cancer screenings probably had the same number of occurrences of breast cancer, but that their bodies had somehow corrected the abnormalities on their own. And of course, this makes complete sense because our immune systems are set up to recognize and destroy cancers in the right environment. And the right environment, of course, is enough sleep, a low glycemic diet, enough vitamin D, and also regular handling of resentments and anger and grief and loss. I think what I want women to know is these two breasts are not two potentially pre-malignant lesions sitting on your chest. And so the problem with our paradigm, whether it's tomosynthesis, whether it's mammograms, is that it will find things that never were going to go anywhere. And then you're out there wearing a pink ribbon and running for the cure and thinking that you were going to die of breast cancer when you never will and never would. And I consider that a huge problem. 1.3 million women diagnosed with something that was never going to be a problem.
Yes, indeed. And what I find particularly abhorrent is the number of women who are prophylactically having both of their breasts removed. I mean, it's just incomprehensible almost, based on this fear. The fear is valid. I mean, it is the number one cause of cancer in women, but slopping off both of your breasts isn't necessarily the way to treat it or screen for it necessarily. So. And I just wanted to mention, too, that that first study you cited by Gill, because many of our readers or viewers are not medically literate, it was published in the New England Journal of Medicine, which is considered by most physicians to be the leading, most prestigious medical journal in the world. So it wasn't a rinky-dink journal. I mean, this is coming out from about the most high-powered journal you can. So just to reinforce what the comments on what you were saying. So as I said, it's the number one cause of cancer in women, breast cancer. So there's a concern there. So aside from the lifestyle changes you recommended and the emotional healthy strategies, is there an effective screening? I know you're not a big fan of screening, but is there a screening like thermography? What would your position be on that?
It can't hurt you. I mean, we know that if you get a mammogram every year for 10 years, you're guaranteed to have a biopsy. This is not benign. These are not benign procedures. But a thermogram is a completely benign procedure, and it simply measures heat coming from your breast. And we know that almost all cancers start with cellular inflammation, and that causes heat, just like you pound your thumb and it gets hot and red. So with a thermogram, and by the way, thermography is not new. It's been out since the 70s, but it's a different paradigm. It measures something that is happening, blood flow to the breast. And you can follow the patterns over time. And if there's inflammation there, and it's graded on gradients of 1 to 100, if there's inflammation, you could begin to do lifestyle changes, and you will see a change in that thermogram within 3 to 6 months. To me, that's prevention. If you're going to get a mammogram, remember it's different. It's the picture in time. It's like an X-ray, whereas a thermogram is measuring the heat right at that moment. They're two different things. So a good thermographer, if they see an abnormal pattern, they'll always recommend a mammogram. But remember, everyone should know this, it takes a long time for one cell to divide and get to an actual invasive breast cancer. What if we could see those patterns in the breast long before there was any cancer, even on mammography or tomosynthesis, whatever, and do the interventions necessary? And that's what I think the future is in breast care, because you can go in and know that things look good, or if they don't look good, do some things like begin to get your vitamin D up to an optimal level, take more kelp. Breast tissue needs iodine. It actually has active importers of iodine, and we have an epidemic of suboptimal vitamin D and suboptimal iodine in our diet. Those are just two things that a woman could do, and decrease her risk down the line. So this is a real upstream modality. Thermography is an upstream modality. One of the problems with thermography is that some thermographers have been saying, oh, you don't need mammography. You can use both. But in general, if it were me, when the thermogram is okay, then I would be confident that the other is not so necessary.
Yeah, and one of the other distinctions between the two diagnostic approaches is that mammography or 3D tomosynthesis is ionizing radiation. So if one uses that regularly, not only over 10 years will you increase your risk for breast biopsy and going down that whole pathway, but you actually increase your risk for causing cancer, because we know, I mean, it's not a mystery. Increased exposure to ionizing radiation increases your cancer risk. I mean, that's just well proven. There's no expert's going to dispute that. And then thermography there's no radiation at all. It's just a sensor. It's like a thermometer. So there's no radiation. So there's virtually no risk at all. And one of the approaches that many people who utilize thermography find is that acupuncture as an adjunctive modality is also useful. So I'm wondering if you could comment on the use of acupuncture, if you have any experience with it, and some of the other modalities.
I see an acupuncturist on a regular basis in change of seasons. And traditional Chinese medicine is also a very upstream modality. And the language is completely different. So they'll talk about excess yang, liver fire, all of these things. And they don't see the breasts as separate entities from the heart, from the cardiovascular system. It's a very holistic system. I completely agree with you about acupuncture.
Thank you for that answer on the acupuncture. I didn't realize you hadn't implemented it for patients with thermography, but maybe you can highlight some of the strategies you would recommend and encourage your patients who do come back with findings on thermography that are suggestive of a premalignancy.
Okay. What anyone needs to do when they have, when they're getting a nudge from their body's wisdom, let's say that it's a breast thing. Let's go back to the symbolism of the breast. They are two organs on the body that were designed. We are mammals. These are mammary glands. And these are designed to nurture children and provide nurturance for us and also pleasure. What I find with many women, and you'll find the ones that are most at risk, are the ones who come in and they don't want to bother anyone. I've talked with Dixie Mills, one of my breast cancer surgeon friends and colleagues. She said, you can always tell the women who are at risk. They come in alone because they don't want to bother anyone. So the first thing you need to understand is you have to learn how to receive rest, how to receive pleasure, and that's going to be the primary intervention that I would do. Obviously, I would get a vitamin D level right away and get you up to an optimal level of vitamin D. Dr. Cedric Garland has talked at length about the link between low vitamin D and breast cancer. But the primary thing emotionally, and remember, every emotion is associated with a biochemical reality in the body. So you want to bring in the emotions of generosity, pleasure, receiving, open-heartedness. The same things that create heart health create breast health. Possibly a supplement with coenzyme Q10 is important, a good antioxidant supplement. Low glycemic diet, sugar in all of its forms, excess sugar increases insulin. Insulin and high blood sugar change the way estrogen is metabolized. And we know that those with the highest estrogen levels have the highest risk for breast cancer. So let's ameliorate that estrogen dominance. We know that those who ovulate regularly and have enough progesterone have a lower risk of breast cancer. So we do all of those things, but primarily, and you do this every morning in the shower, here it is. You massage your breasts and you say, girls, you're safe with me. You actually start. Remember, the hands come from the same segment of the embryo. that creates the heart. So your hands are an extension of your heart. And we know from Kirlian photography that your hands have healing abilities. Any mother knows this. I used to heal my kids' tummy aches by just putting my hands on there and saying, I'm healing you. And then you heal them. So you bring your own hands, your own heart to your own breast tissue, and you let it know that you are going to provide nurturance and safety, and you're going to ask others to assist you. This is the biggest stumbling block for women. We're so afraid of appearing selfish. So here's what we do. To get the nutrients of pleasure and receiving that we all need for optimal brain health, the beta endorphin, feel-good chemicals in the brain, we import it through alcohol and sugar, when we can import it directly through self-love, meditation, exercise, and good sex, which you can do with yourself.
Well, that's terrific. You know, it's frequently, at least the experts I connect with tend not to emphasize the emotional component so much, but it really is a crucial element, probably every bit as much or even more so than the physical elements you just mentioned.
Found that and same goes with birthing. People tend to get stuck in labor right at the point when they most need emotional support. After all these years, I have discovered that it is this self-love thing. Bernie Siegel, pediatric surgeon from Yale, Bernie Siegel and I were co-presidents of the American Holistic Medical Association back in the early 90s. And Bernie used to say, I have come to see that the fundamental problem most patients face is the inability to love themselves. And, you know, I remember thinking, God, Bernie, that seems pretty simple to me. And you know what? He's right. The older you get, the more you realize this. And so spending some time loving yourself when you feel unlovable. And the way you do that, by the way, is you love yourself for feeling unlovable. This is, I learned from Gay Hendricks. I don't feel lovable, so I'm going to love myself for that. It's a paradox.
Yeah, one of the strategies that we use in our practice is emotional psychology techniques, which our specific version is emotional freedom technique, or EFT, which I'm sure you're familiar with. And the default affirmation is just that, to love and accept yourself from no matter what the search. And that is such a powerful healing affirmation that it has profound influence. And you know, I've worked with thousands, tens of thousands of patients like yourself, and boy, I've never seen anything more magical than once that's integrated into a person's neurology to produce the resolution of all these physical symptoms. It's just, it's nothing short of a miracle.
It is, and then, you know, think about what happens when you do that. You get an increase in nitric oxide in every blood vessel in the body, and remember, a capillary is a micron away from every cell in the body. Nitric oxide is produced by the endothelial lining of every blood vessel in the body, and it's increased in all situations of health. Self-love, aerobic exercise, antioxidant vitamins, eating your vegetables, and nitric oxide is the molecule of life force. It also balances all the neurotransmitters instantaneously. So that's serotonin, dopamine, beta endorphin, all those things for which 1 in 10 Americans is on an antidepressant. So when you do this self-love thing, this is medical. I want people to know it's medical. It's not some pie in the sky, touchy-feely thing. It literally is biochemical.
Now, I like one other comment too on the dietary recommendations, because that's one of my passions, one of the things I focus on. I've learned some new information within the last year that I think may even, it's a slight tweak or modification of the low glycemic diet, because there's 3 categories of macronutrients. You've got carbs, proteins, and fats. So the challenge when most people go on a low carb diet is that they tend to replace it with high protein rather than healthy fats. And that may be every bit as pernicious as the carbohydrates. because there's this newly discovered pathway, which I'm sure you're familiar with, it's called mTOR, which is a cancer pathway. It promotes cellular proliferation and is fed by excess protein. So you've got to be really careful and keep your protein levels probably about half of what most people normally eat. So if you eat lots of meat, it's not necessarily the animal protein is the issue, but it's too much of it that can cause especially cancer issues. So that's what I'm learning, and the key is to replace those carbs with healthy fats like avocados, coconut oil, butter, eggs, not the omega-6 processed vegetable oils, but doing that can go a great way towards suppressing those cancer genes.
No, I absolutely agree with that. Do you know Dr. Gundry's work? He wrote Diet Evolution.
Now, I'm not familiar with him.
Wonderful cardiovascular surgeon from Loma Linda. And he points out that our genes just want to reproduce. So the diet that we've created, the standard American diet, is in fact a success. People are reaching puberty at the age of 8 so that they can reproduce, and then that same diet will kill them off so that they won't be available to compete for the limited food supply. If you look at this from the longest possible trajectory, and that's why you want to constantly be telling your genes there's not quite enough. It's not winter. You don't need to store up fat for the winter, because that's what our bodies do. And we have to let them know this one can survive. Your genes can survive. You got to eat to make sure that your genes want to survive and not kill you off.
Yeah, I totally agree, especially replicating what our ancestors did. And one of those things was that we didn't have access to food all the time, so we went through regular intervals of fasting. So that's why I've been strongly recommending and endorsing the intermittent fasting principle, and something I've adopted for like the last half year or so. And it's pretty fantastic because it tends to upregulate your fat-burning genes, and so this hunger, this desire to replace those carbs, because if you have that carbohydrate craving, it's very difficult to exert enough willpower. I think the average person, probably 99.9% of people don't have the willpower to get over that hunger urge. So the issue is to turn off the urge, not with drugs or anything, but just with changing your metabolism and regulating your fat-burning enzymes, which intermittent fasting tends to do.
And now, how do you do that intermittent fast? What do you do? Is it
normally
vegetable juices? Just
no. Even if intermittent fasting is just the process where you restrict your calories to about an 8-hour window, but you start slowly. You tend not to eat anything before you go to sleep for 3 hours, and then gradually extend the length of time that you start to eat your first meal to the point where you finally get it to noon or lunchtime or 1 o'clock. And then, so you can have the same amount of calories, it's just compressed within an 8-hour window.
That's so interesting. I've been doing that just automatically.
Yeah.
It's just what works. It's just what works. That's great. And I agree with you. I never would have thought that I personally would get to the point where carbs didn't sing to me, chocolate brownies didn't sing to me, the bakeries and all that. But I have gotten to that point. I want everyone to know that that's a possibility. There's no less pleasure in life because of it. It's not a restrictive, let's go to the convent thing. It's really your body loves it.
Well, thank you for that powerful testimony, because for me, that was exactly my experience. It's really another almost magical sensation. It's not a willpower issue at all. It's just not necessary, because your body has the ability to metabolize and burn that fuel that we're all storing as fat, which it was designed to do. But most people can't.
That's right. Have you had any experience with the HCG diet by any chance?
I have not personally. I know a number of people who've had some good results with it. I think it probably is effective if it's done properly, but it may not be necessary. But a large part of it, you're getting low protein, low carbs. It's only 500 calories for a few weeks, I believe. So,
that's right.
So it's a type of fasting.
Type of fasting. What it does, it seems to turn on that ability to fast. It's sort of the first thing that happens is you realize, oh my, how many times you put something in your mouth during the day, and you can have a kind of a panic. Oh my God, I'm going to have to do this thing, and then you get over it. So there's a kind of withdrawal, but that only takes a day or two. I guess I want people to know this is easier than you think.
Absolutely. So thank you for sharing that information. And I'm wondering, since we like to focus on your specialty, which is of course women's health, and I'm wondering if you can provide your top 10 tips for keeping women healthy? I mean, we've certainly got one, really one of the most important ones is what we just were discussing, which is the breast health, but I'm sure there's many others.
Sleep. Absolutely essential. Sleep is the thing that metabolizes stress hormones better than any other known entity. And many, many women are running on not even nearly enough sleep. So let me just brag to everyone and give you permission. I sometimes sleep 12 hours, and I need it, and it works for me. Great apes sleep at least 10 hours or more, and Albert Einstein always slept 10 hours a night. So we live in a sleep macho culture where people brag about how little sleep they need. So get enough sleep. Number 2, you need to do some kind of meditation every day, and that can be for 3 minutes. You don't need any more than 15 minutes where you calm your mind. 3, affirmations of some kind. Begin your day by pre-paving with a positive thought. So for me today, it was the Christ mind within me. This works whether you're Jewish or Muslim because it's an energy. The Christ mind within me now dissolves anger, fear, and doubt, and I am magnetic to my good. So that was my affirmation this morning from Florence Scovel Shinn's book, The Game of Life and How to Play It. So you want to have some inspirational literature. It can be the Bible. It can be whatever you want so that you begin your day in that way. 4, you need some kind of body movement exercise. I'm thrilled by the fact that the collagen matrix of your body, the connective tissue, is a crystal, and even rubbing a tennis ball along the arch of your foot changes your whole body. So some kind of body movement, yoga, a walk, something where you're moving your body. 5, breathing properly. When you breathe in fully through your nose and out through your nose or your mouth, but let's try in through the nose, you are activating the parasympathetic rest and restore nervous system, which expands the lower lobes of your lungs and therefore engages the vagus nerve. So let's just all do this together. Deep breath through your nose and out. And relax the back of your throat. So many women have thyroid problems, and it's from chronic tension here because you're pretty sure your feminine voice isn't going to be heard. It hasn't been heard for 5,000 years, so you're not alone, but it's being heard now. So deep breath through your nose, relaxing the back of your throat. It expands your rib cage and instantly brings in the parasympathetic rest and restore nervous system. All right, number 6, I'm going to say in the mirror at least once a day. As you pass the mirror, you look deeply into your eyes and you say, I love you. I really love you. After 21 days, something will happen to you. You'll see a part of you that looks back at you and you begin to believe it. I love you. I really love you. Next one, get your vitamin D level checked. Optimal is 40 to 100 nanograms per ml. And this is on the radar screen now of medicine more than it has been in a long, long time. Sunlight is not the enemy. It's lack of antioxidants in your diet that are the enemy. Natural light is a lovely source of vitamin D. You can't overdose. But many people, to get their levels of vitamin D into optimal, are going to need 5,000 to 10,000 international units per day. So vitamin D is important, and you can get your level drawn through mymedlab.com without a doctor's prescription. You need social nutrients. We say community equals immunity. I say that. When we're around other people who are like-minded, that actually provides us with a tribe. And we are herd creatures. Mammals are herd creatures. So you need a group of people that you're doing something with. And that could be a ski group, a running group, whatever. Facebook has made this easier than ever, but you need people that you are in actual physical contact with. Actual physical contact. 9, I would say baths in Epsom salt are a great way to get magnesium into your body. We need more magnesium. Epsom salt is magnesium sulfate. I love baths, and 20 minutes 3 times a week soaking in a bath with a cup of Epsom salt is a lovely way to relax. And then finally, before you go to bed at night, write down 5 things that you appreciate, 5 things you're grateful for, or 5 things that brought you pleasure. And this will seed your rest and restore sleep period with positive energy that will return to you in your dreams. So you see, we went to bed at night for sleep, and then we got all the way back to what you do before you go to bed at night.
Yes, indeed. So on the sleep, I'm wondering if you're familiar with some new technology that can help, because sleep is, other than the variable of measuring how long you're asleep, it's very difficult to measure the quality of the sleep. So there's technologies, the most prominent one is called ZEO, Z-E-O, I'm not sure if you've heard of it, but it's less than $100 on Amazon, and it's a sensor you wear over your forehead at night. And it will monitor when you fall asleep, how many times a night you wake up, how long you wake up, how long you're sleeping, how much deep sleep you have, REM sleep, and light sleep. And then it will give you an objective score so you can actually quantify. And I've been using this for a few years now. It has been absolutely a magnificent tool, because I was one of those people who prided myself on sleeping less. I would rarely sleep over 6 hours. And now it's typically closer to 7.5 hours, and my scores are really good, or close to 100. I sleep better, and they've got a pretty big database than about 90%, 95% of the people, at least the people that are recording on ZEO, which is probably a good reflection of the population. So it's a really cool tool, because you can't lie with the numbers, you know. And it's a pretty useful tool. So thank you for those really useful appreciations. I like the gratitude. I do the gratitude thing, but I never thought about doing it before you go to bed to integrate that with the rest period, and it makes a lot of sense.
Great.
So would you, I know you focus your primary strategies on women's health, but are there any additional ones that you might have for men, considering the differences between the sexes?
Absolutely. I believe that the epidemic of prostate cancer is the same for men as the breast cancer with women. And Aaron Katz is was head of the Holistic Urology Center at Columbia in New York City. When I heard that there was a Holistic Urology Center, I was thrilled. And what he points out is 90% of prostate cancer will never leave the capsule. And so he has a program of active surveillance. I would like men to not have this sort of Damocles hanging over their head called the PSA. And I'm sure you've done shows on this. The prostate-specific antigen test, I remember reading that the guy who invented it was reported as saying that this was the biggest disaster in public health that was ever perpetrated on men. And it can be useful for monitoring, but I want men to realize that they're not sitting ducks for prostate cancer, and the same things that keep women healthy with the breast keep men healthy with the prostate. And along those lines, one of the studies that I half-jokingly suggested to Dr. Katz was that men learn Argentine tango. We have some studies actually that show that that decreases anxiety and depression. It's a close embrace partner dance. By the way, partner dance is the Uber activity for preventing dementia. Better than golf, better than all those other things. So partner dancing, because in Argentine tango, you have to show up as a man. You have to lead, you got to protect your partner, you have to cherish her so that she feels loved, you have to know where her feet are, you have to negotiate around the dance floor. It's all done with gorgeous people pressed up against you while you are cherishing them to beautiful, sensual music. I believe that this was the best thing that men could possibly do for their health.
Oh, that's a good recommendation. I'll have to take you up on that one day, or at least apply it myself. Beginning back to the women's health now, it would be a sort of a tragedy having you on the interview and not having you review, or at least put in proper context, the importance of proper breast self-examination. You know, how important do you think that is? How regularly should it be done? And then maybe you can give some description or explanation of how that should be done.
Well, the truth is that there was a huge study done in China that showed that in teaching women, factory women, how to examine their breasts did not decrease their mortality at all. In fact, all it did was increase the number of biopsies for benign disease. So there's no data that breast self-exam helps with anything. So let me do a complete one-quarter turn on this. I recommend a monthly or weekly self-love breast massage, not to find something, because here's how breast exam is taught. Make your hands into two minesweepers and then touch your breast to find something that may kill you. This is why women don't do it. But imagine maybe with your Epsom salt bath or your self-loving shower, you rub your hands together, create a nice energy field, which we could measure with the right tools. And then you lovingly, I would start here. The tail of Spence is this part of the breast up under the axilla, up under the armpit. This is where all the lymph nodes are. And just massage this with love. Massage this with love. You're not looking for anything. Let me tell you something. The average woman will find something. We know that breast self-exam, or just a woman finding something because she knows her breasts, is just as good as all this other screening stuff for finding the fast-growing tumors. See, the problem with screening is it finds the slow-growing ones that may regress or wouldn't go anywhere anyway. So, for part of your health, you want to start a practice of bringing your breasts home to your chest. I had a patient once, she says, my breasts are being taken care of at the Leahy Clinic. Good clinic. I said, my breasts are being taken care of on my chest. So I want you to take care of your breasts on your chest, lovingly get to know them in health, lovingly. Don't use your fingertips, by the way. Use this part. Use this part. Otherwise, you're going to feel every little gland and freak out. So this part, until you know what's there normally. And then if you do find that you have what's called fibrocystic disease, where your breasts get tender, start eating some kelp tablets, because the iodine really helps that in a huge way. So that's how you're going to do it. You're just going to do lovingly getting to know your breasts, and maybe have a little sign, time for breast love. And you can do that once a month. With women, the best time to do it is just after your period, when you have the least amount of hormonal stimulation. So you just get to know. Remember that the breasts in ovulating women follow the same pattern as your ovaries, and your ovaries follow the phases of the moon. So you might want to get in touch with that universal energy that is influencing the flow of fluids in your body. You're part of that bigger picture, and that's pretty wonderful.
Do you with respect to the massage, do you think there's some benefit to lymphatic movement and moving the tissues around for breast health?
I do. In fact, I think that massage, regular massage, should be part of everybody's health practice. We didn't include it as the top 10, but touch. We all need touch. We're touch starved in our culture. I mean, we touch our dog and our cat more than we touch each other, right? That's one of the other benefits of tango, because we're touching, we're embracing, and we're therefore increasing our prolactin levels, our oxytocin levels. These are the bonding hormones that lower blood pressure and decrease your disease risk. So massage, absolutely a great idea. If you have a loving partner, your loving partner can do it for you. It's a very good health practice, but get it out of the category of minesweeper. That's just the wrong energy to bring to it. And by the law of attraction, the more we look for something wrong, the more we find, which is why it's better to start looking for what's going right.
Yes, and we can learn from your dad's example of attracting his early demise at 68 on the tennis court.
Exactly. It's like he had it all set up. A blood vessel's going to pop in my head. I'll float out into the universe. There you go. But we don't know if that was his soul's choice or not. I'm fascinated by that. Like with that wonderful person, Chris Carr, Crazy Sexy Diet. I think about Chris and the fact that she still has this stage 4 cancer that has been in remission for 10 years because of her wonderful dietary program and advice. And to me, that looks like soul work. She gets a type of cancer I can't even pronounce. It's so rare. And then she teaches the masses how to eat better. She has to do it because she's on a really short leash, but she's showing the world how a very rare, strange cancer is just kept in equilibrium, in ecology with her body, because she's loving her body and feeding it so beautifully.
Yes, it's a powerful message. And I'd like to comment also on one of your other recommendations in your top 10, which is and affirm and endorse it, is the magnesium sulfate Epsom salt baths. And you had mentioned that it's good for magnesium. It certainly is, and it's one of my favorite minerals. So it's so much more important than calcium. I mean, we need calcium, but we have enough typically. And actually, it's the excess of calcium intracellularly that sort of leads to premature death. And magnesium helps get it out of the cell. But the other, I think, hidden ingredient is the sulfur. And the sulfur is just maybe even more important than the magnesium. So you get both. You not only get the magnesium, you get the sulfur. And that's one of the reasons why people migrate or do these pilgrimages to these sulfur hot springs, is to get that sulfur in their system, because so many of us are deficient in it. I mean, you mentioned iodine and vitamin D, but the sulfur is an emerging appreciation of the importance of it in our metabolic pathways.
This is cheap. You and I both. We want people to be able to stay well without spending a fortune. And this is a great way to do it. I buy it in these big vats, keep it right by the bathtub.
Yes, indeed. It's inexpensive and it's healthy, so it's a good thing to do. Probably a good idea to fill that bathtub with some type of water that's been filtered from chlorine, though, to get the disinfection byproducts out. Because it's good to get the sulfur, but you don't want to get the chlorine and stuff. All right. Well, thank you so much for being a pioneer in women's health, and really encouraging, motivating, and instructing people, women specifically, on how to maximize their health and take control of their health. You're a real important messenger in that area.